Hey, Dr. Joe Smith here at Atlas Health, continuing on 100 days, 100 videos in 100 days. Today is day 11. And so, you know that feeling that you get when you stand up quickly and, like, for a second it feels like the lights are going to go out? You know what I'm talking about? Where, like, everything just kind of starts to fade to black a little bit. And you're like, whoa, what was that? Maybe you're crouched down or you're in bed and you get up to stand quickly. Or maybe you don't get that feeling where the lights are going to go out, but you just feel like unsteady for a minute, or your heart starts to beat really fast. You know that feeling? So a lot of people go to see a doctor, right? Say they have like depression, or they have anxiety, or they have like a chronic digestive issue like acid reflux or SIBO or leaky gut or something like that. They have a chronic issue like in their right shoulder or their knee. And so they might go see a PT person or a chiropractor or acupuncturist that does some sort of work specific around the joint. And they've tried all these different things. And it's like, well, why is it not lasting, or why is it not really helping much at all, right? And so I wanted to share with you today one of the common things that comes up during our history, and that's that feeling of dizziness or lightheadedness that can happen at any time. So imagine the neurons in your brain have the set point, right? And so the set point is like this Goldilocks range where they'll fire very rapidly when they're supposed to, but they aren't super close to threshold and they aren't like super far away from threshold. So what I mean by that is, say, you know, when somebody has like too much coffee, how they could get a little jittery or jumpy, or like sometimes people that are afraid of the dark, right? They get a little jittery or jumpy all of a sudden, you know? Or maybe somebody took too much medication, or they had too much alcohol and they're like asleep, and you're like trying to wake them up, and you're like poking at them and say, hey, let's go, it's time to go. And they're just not responding. Okay. So the person who had coffee in this case is a little close to threshold in the brain, meaning their brain got amped up, and so they're closer to firing, and they're going to fire more spontaneously and more quickly. The person that took a depressant, now their brain is further away from threshold, and so they can't really be roused or woken up, right? And so what I see a lot in clinical practice is that when I do a history, and a lot of times cases that are not resolving to like standardly what would work, like if they do exercise and they're depressed, they don't feel better like a lot of people, or they take a medication and they just don't feel better like a lot of people would when they take that medicine, or they do their gut protocol and their gut issue doesn't resolve, they're still bloated, right? The question is, well, what's going on in this individual that makes them unresponsive to what's working for a lot of people, right? And one question that comes up all the time is, hey, do you feel lightheaded when you stand up, or do you get dizzy, or your heart start to beat fast? Okay, so imagine a neuron has like a Goldilocks range. We kind of talked about this like a minute ago, right? And so there's this little pump inside of every neuron, okay, and that like embedded in the cell wall called a sodium-potassium pump, and it pumps out sodium and potassium, or pumps it in at a ratio to keep the neuron like at a happy threshold. Okay, so not the coffee threshold where it's close to firing, or the alcohol threshold where it's further away from firing, but actually right in the middle, right in the sweet spot. Okay, and a lot of people have low blood pressure, or when they stand, their blood pressure drops. Okay, and what ends up happening is now those neurons that were like in the sweet spot Goldilocks range, now they're not getting blood, so they fire more spontaneously to try to get themselves stable, right? Because what happens is they're losing blood, and so now they're becoming metabolically inefficient, and so the first attempt to try to stabilize itself is that it fires more quickly. So that's a person with anxiety that's lightheaded a lot, okay? Or they start getting anxious and they start getting sensitive to light and sound, because now their brain is starting to like fatigue, and they can't regulate their other senses like hearing and sight, okay? So think about the brain. About 85% of it should fire into a part of the brainstem that connects to a nerve called the vagus nerve. And so can you imagine that if you have some asymmetry there, so one side of your brain starts to fatigue out because of this lack of oxygen, and the left vagus nerve goes to one side of the heart, and the right vagus nerve goes to the other part of the heart that regulates another function, that since they're not even anymore, the heart rate could start to spike. It could start to beat kind of fast, or it could start to beat funny. You might get what's called a palpitation or an arrhythmia, right? You ever been told that you have those things? and you also have unresolved digestive issues or anxiety or depression or like a chronic pain syndrome, it might be that the story of low blood flow to the brain is a big part of this unresolved phenomenon. And that's kind of the gist of what I'm trying to get across today. And then paradoxically, it would make sense that, well, not paradoxically, but it would make sense then we just want to try to get blood flow to the brain. And by getting blood flow to the brain, then suddenly these symptoms of like dizziness upon standing might go away, or like sensitivity to light and sound might go away, or the anxiety might go away. I mean, imagine if you're sitting there and your brain is at a much closer rate to firing because of this lack of oxygen. That person might be kind of a sensitive person, right? They might not have a lot of stamina or a lot of endurance. So like you might be talking to somebody and you're like, okay, you really don't like where the conversation's going and it's frustrating to you, but you're able to like, you know, rationalize staying calm and talking through it, right? Well, the person that can like hear like one or two statements before they start losing their mind and blowing their stack might be a person that has a close to threshold brain and it just like fires and then it fatigues and now all of a sudden they're like super impatient and they're having a hard time, right? So emotionally they can't regulate their emotions. That person might be just kind of a sensitive person a lot of the time because they're just basically sitting at a threshold where their brain could fatigue at any moment and then they start getting emotional or having what's called a limbic escape, okay? So things that might help circulation, things like ginkgo biloba or things like exercise, kind of makes sense, right? Okay, but the reality is this. Sometimes people exercise and they feel awesome, okay? Sometimes people exercise and are like way more dizzy after they exercise. Do you know anybody like that? Or they take a supplement that's supposed to help with blood flow to their brain, like they take something with ginkgo in it, or they take something that affects like a nitric oxide system or dilation or constriction of blood vessels, or they may take a blood pressure medicine and their blood pressure all of a sudden drops and they get dizzy, or their blood pressure is not being regulated properly and it's too high and they get dizzy. Have you ever heard of stuff like that? Like when you look at blood pressure medicine, you might see like all the side effects include dizziness. By the way, I'm not saying don't take your blood pressure medicine, right? So sometimes when we do things that are supposed to help, they get worse, right? And that's another big sign that this blood circulation or brain-based issue is taking paramount. Because let's say like you did something that globally sent blood flow to your brain, or like you took a supplement that improved mitochondria, right? So the mitochondria now function more efficiently. Now, I think supplements that improve blood flow to the brain and are good for mitochondria are awesome supplements. However, if a person is dizzy already and then they take something that improves brain efficiency and they're more dizzy, imagine that neuron that's at like the close to threshold gets more efficient in their energy. Well, maybe that brings them down, and so now they're like in the sweet spot, the Goldilocks range. Okay, but what if they take something that improves their mitochondrial efficiency, but the neurons themselves are directing somebody into an anxious state, right? So now all of a sudden, maybe a neuron that was down here in the Goldilocks range gets a little bit more support, and now they go closer to threshold and they start firing spontaneously. That's the person that maybe gets anxiety as the result of taking a supplement, or they get dizzy as the result of taking a supplement. It may not be a detox reaction. It might actually be that their brain is not responding globally the way that they want. That one circuit that's dominating other circuits is firing better, but the net result of that is a less efficient integration of different aspects of brain. And so this is something that we see a lot, where one person might try to take something supplement-wise that should help, and the symptom specifically is like some sort of palpitation or some sort of increase in heart rate or dizziness. And that's like a really big red flag to hold on, to hold your horses, take a second, take a step back and go, okay, that's probably not normal, and I should consider discontinuing this if it's something you took on your own, or if it's something that was prescribed to you, you should really consider talking to your primary care and see if you can get that sorted out. Or if it's a supplement that a clinician gave to you, talk to the clinician and say, this is the result I'm having. And if they say that it's a detox reaction, be really careful. Maybe it is a detox reaction, but one way to know for sure is to like look at things like blood pressure, seated and standing, to actually listen to the heart, and to look at heart rate. And that way, you know, if your exam is matching up with what a person's experiencing versus just like dismissing somebody and, you know, classifying it as a detox reaction or, you know, quitting altogether and giving up just because it didn't work. Like there's a way to navigate around that. So anyway, for those of you that are like, man, I have this chronic issue and I also get dizzy when I stand up, or I'm lightheaded when I stand up, or I have this like change in how my heart fires like rapidly sometimes, or it starts to beat funny or beat fast, and I have anxiety or depression, and I have like a chronic gut issue or chronic pain, it might be worth consulting somebody that understands functional neurology. And there's functional neurology doctors all over the world. So just a really cool part of the exam that comes up that I think often gets overlooked. And it might be useful to get that conversation going with whoever's helping you deal with your issues so that you can get to that next level. Okay, have a great day.